So, for this discussion, I would like to give a brief overview of an introduction to billing. And as with every topic within this channel, each individual topic could be 1 hour to a 1 day uh, session specifically on that topic. So, what I'm providing is pretty much the down and dirty of the need to knows starting out. In billing for patient encounters. So starting on the bottom left and just moving, in a clockwise fashion, the first term that's important to recognize is ICD-10. ICD standing for International Classification of Diseases, being the 10th revision. Um, these are maintained by the National Center for Health Statistics, which is a part of the CDC, or Center for Disease Control. And these are going to be um, your diagnosis codes. These are the things that you are probably the most familiar with. This ranges anywhere from something as simple as headache to headache unspecified, to abdominal pain, to very, very detailed codes for a diagnosis. And these are um, alphanumeric codes, um, and there are modifiers within those codes that can differentiate location um, and symptoms. So just knowing that your ICD-10 codes, these are your diagnosis codes uh, that you use for every patient encounter. Next, we have CPT. CPT stands for Current Procedural Terminology. These are coding and billing codes, codes for billing for services and procedures. This set of codes is maintained and updated by the American Medical Association. These are going to be the codes that you're most familiar with as an advanced practice clinician as far as selecting billing codes for services rendered. And CPT codes are broken down into 3 separate categories, category 1, 2, and 3. And what you will be mostly using um, as an advanced practice clinician billing for patient encounters are going to be your category 1 codes. And the category 1s just have a descriptor corresponding either to a procedure or a service. Your category 2, these are your alphanumeric codes, and they're a supplemental code that isn't required but is sometimes useful. And then your category 3s are alphanumeric codes. These are for either new technology, new medications, and trials, things like that. So not all that common, and likely that you won't run into these in your everyday practice. That doesn't mean you won't, but that just so you do have an understanding that they are broken up um, into the three categories. The next definition to talk about are HCPCS, HCPCS, which stands for Healthcare Common Procedures Coding System. And just like the CPT codes, HCPCS are broken down into 2 levels, level 1 and level 2. And I will dive deeper into the differentiation between level 1 and level 2 HCPCS, but what's important to understand from this is that there are going to be times when you are using the HCPCS codes, and typically that is going to be when you are reporting the use of product, equipment, or procedures that are not a part of the CPT code. And HCPCS are maintained by CMS, Center for Medicare and Medicaid Services. And another important definition to discuss when getting a basic understanding of billing practices are bundled payments. And a lot of times in the outpatient world, walk-in clinic, urgent care, um, nursing home, home visits, etc., you're typically billing for an individual service or visit um, separate from other care provided. However, there are times when certain services, particularly things such as um, certain things like cardiac care or joint replacements, to name a couple examples, um, have a global charge for the entire episode of care. And what that means is, and this is all dependent on the procedure or the um, the, the the type of care, but typically the bundled payment is going to initiate from hospitalization, sometimes even a pre-hospitalization evaluation, all the way through the care within the hospitalization, as well as any outpatient care due to the event or procedure or service provided. And so this may mean a patient who comes in with an elective joint replacement and ends up having the inability to go straight from the hospital back to their home setting and needs skilled nursing care for a week, rather than that reimbursement all being allocated to the surgical and hospital care. It is then spread out um, throughout the care within the skilled nursing facility. So not to dive into the weeds of um, the intricacies of all the different areas in which you might see bundled care, but just know that depending on what type of service you're providing or what area you practice, you may run into um, to care that does fall under bundled payments. And so just knowing that what that means for you and your billing practice is going to be a little different than individual episodic care, um, which is billed by the visit. Next are carve-outs, and I included in carve-outs modifiers. And it's important to talk about carve-outs or modifiers because there are going to be times when a patient presents to you for, say, a wellness visit, an annual exam, and has a very separate but medically necessary need, perhaps. Some examples that I've thought up in other discussions: a joint injection, a skin biopsy, um, etc. Um, or another example would be they bring up a chronic condition that has not been addressed that requires extensive diagnostics and referral to a specialist. In the cases um, of, of these patients, you are going to create a carve out using a modifier, in this case a modifier 25, which adds on an episodic visit to, or an E&M visit, evaluation and management visit, to the wellness or preventative visit. And the reason this is important is um, you are billing for the amount of time and medical level of medical decision making required of that visit. And there are going to be times when, you know, almost always a patient comes in for perhaps an annual wellness exam, and they do bring up some small chronic conditions that don't take a lot of higher level medical decision making. But there are times when it is important to add that carve out in to bill for the services rendered. So just knowing that that is an option, but it does need to be added into your billing practice, or you will not be reimbursed separately for that episodic care. Also, offices are leaning towards notifying patients ahead of time or having the discussion with patients ahead of time that these episodic visits within the annual visit are going to be billed out separately, and they may be responsible for all or part of the payment for that episodic care. So just be cognizant, especially as if you're a new provider, knowing that your patient may not understand that they might have to pay for additional care, thinking that it is all covered under the umbrella of preventative medicine. And just to go quickly through my last point, because I do realize this discussion is getting a little bit long. RVUs, and RVU stands for relative value units, and I think this is a topic that is very, very rarely discussed in the school setting for advanced practice clinicians. And a basic definition of relative value units. These are a value that is assigned to a service provided. These are assigned by CMS, and there are several different types, and there's a formula that I'm going to discuss in a different, very short discussion, hopefully short discussion, so that you understand what an RVU means and how RVUs are put together into a formula to determine the final payment to the provider for the services provided. So just a few quick pointers about RVUs. They're classified as either a facility or a non-facility RVU because the cost for an evaluation or a procedure in an office setting is going to be different than a cost in a hospital setting, and that's just based on all of the costs to maintain and run a facility versus an office, pay for staff, etc. Also, RVUs are adjusted based on geographic location. And if you think about it, that makes a lot of sense. Nursing care and supplies in Anchorage, Alaska is going to differ, or let's say rural Alaska, that is going to differ very strongly compared to, let's say, urban Los Angeles, for example. So just know that RVUs are adjusted based on where the service is provided. And in one of the following discussions, you can follow along the RVU equation and see just how you can calculate final payment for basically any service provided if you are interested.